Welcome to Black Health, a weekly talk show discussing medical issues impacting and afflicting South Florida's Black community. Now introducing our host, Dr. Michelle Kirwan Bythewood.
Good afternoon. Thank you so much for joining us and welcome to Black Health, a platform to discuss health issues affecting the Black community. I am your host, Dr. Michelle Kirwan Bythewood. I'm a board-certified pediatrician and the Chief Medical Officer at the Pediatric and Family Health and Wellness Center in Miami Gardens. And today I am joined by a special guest, Dr. Sonjia Kenya, a sexologist who is with us to talk about sexual health in the Black community.
Thank you so much for having me here, Dr. Kirwan. I'm so excited to be here.
Absolutely. Before we get into this topic today, which is so important, we just don't have enough conversation around it. I first want to let our audience know a little bit more about your background. Dr. Sonjia Kenya is an Ivy League trained sexologist and a professor at the University of Miami, where she educates current and future physicians on sexual functioning. Her book, Sex in South Beach, was a top 10 bestseller, and her podcast, also called Sex in South Beach, is rated 5 stars on Apple. Dr. Kenya, it's a pleasure to have you, an honor to have you on Black Health today. Let's jump right in. First, what is a sexologist?
Great question. So sexology is the study of human sexuality and sexual behaviors. And a sexologist is someone who specializes in that. Many people might think of a sex therapist, but a sex therapist is just one avenue of practice that a sexologist may go into. So a sexologist can also conduct research like I do. They might educate doctors like I do, or they might do sex therapy, but it's a broad field of science. And my goal as a sexologist is basically to help people have better sexual relationships.
Why are you so passionate about sexual health?
Oh, there's so many reasons why I am extraordinarily obsessed with sexual health. I grew up as a heterosexual Black woman in America. I went to an all-girls Catholic school. The only thing I was taught about sex when I was growing up from school and from providers was that I might get HIV one day. And that wasn't comprehensive at all. And when I got to the age where I was becoming sexually active, I realized I had absolutely no education about how to have fulfilling sexual relationships. And simultaneously, while I was in college studying, HIV was really becoming a huge problem in Black communities. So I want people to remember that sex is really supposed to be a pleasurable thing in life. I like to think about sex like ice cream. It should feel great. And unfortunately, in our Black populations and our communities, sex is often only addressed as a risky behavior. And so I wanted to be a resource where people and society could go to learn how to develop better sexual relationships. And in order to do that, I had to learn for myself.
Okay. So my opening statement was that Black Americans suffer the worst sexual health disparities in the U.S. There's a lot of disease states that we're number one in: diabetes, hypertension, the list goes on, where genetics plays a role, stress, systemic racism, food. Why are we leading the charge here with this disparity when there's so many ways to prevent transmission of STIs? Is this a lack of education around the topic in the Black community?
Absolutely. It's about lack of access in the Black community, lack of access to culturally appropriate education. So making sure education is communicated in ways that we are able to understand it. It's about lack of access to healthcare, because healthcare systems have been historically discriminatory towards Black patients, and we often don't feel comfortable receiving care. And in socially or historically, we have not always been allowed to receive care. Here in Miami, our biggest safety net hospital is the Jackson healthcare system. And there were decades of periods of time when Black people were not allowed to receive care there. Black providers were not allowed to deliver care there. So there's a lot of social and historical reasons that prevent Black people from wanting to even access the healthcare system. And then there is also a lack on the part of healthcare providers and large health organizations to try to communicate all of our sexual health advances to Black populations. Someone may pay for a billboard, but who is that billboard speaking to?
Okay. So talk about education. What do you feel there's a lack of education? I mean, you spoke about it in your own experience, a lack of education in the schools, in higher education, even about sex, even starting just with parenting.
Absolutely. There's still a huge stigma around providing comprehensive sex education. Here in Florida, we're not really allowed to, in public schools, provide any sort of comprehensive sex education. In college, human sexuality persists as an elective for most students. Most doctors feel unprepared to address sexuality because medical school doesn't give them all of the education and training that's needed to appropriately address it with their patient population. And I think in the Black community, there's still a lot of resistance, a lot of reluctance among Black parents to do important work that would prevent unwanted sexual health consequences. We want to prevent unplanned pregnancies. We want to prevent STIs. And one reason we're leading the charge is a lot of parents aren't talking to the next generation about feasible, realistic sexual health practices that will prepare them to engage in safe sexual relationships.
You touched on this a little bit, but talk a little bit more about racism potentially playing a role in this health disparity.
Oh, well, several years ago, the Institutes of Medicine published a study that showed many providers aren't talking to patients about STIs or HIV or prescribing life-saving HIV medications because they actually believe Black patients are less intelligent than other populations or less likely to adhere to the medications. So since they might not do as well as other populations, they just avoid the whole conversation. And so a big part of my work at the University of Miami is educating providers in culturally relevant strategies to deliver this type of care to our patients.
Yeah, I can say when I trained as a pediatrician, so fortunately, much of like sexual function and all of that, I don't have to worry about. But one of the things I did not get much training on was contraception, because teenagers, when I trained, and I hate to date myself, but teenagers were not really that sexually active back then, where we were prescribing a lot of contraception. Now it's completely changed, and I do find that there was a lack of that education when I was in medical school for sure. So hopefully it's on the horizon to change that. One of the other things that can lead to this health disparity is just high risk behaviors. So I think the easy thing is to say, well, African Americans are engaging in riskier sexual behaviors. Is that the case?
African Americans are underutilizing our medical advances that keep us sexually safe. So there's several, science is moving so rapidly these days. And there are so many ways to have fulfilling, safe sexual relationships. And what we found over and over again is many of these medical advances are just not utilized by Black people in the United States. One reason is distrust of the formal healthcare system. The legacy of the Tuskegee experiment is still very, very prevalent among our populations with the least amount of formal education. And that population is also suffers from the greatest HIV and risk for poor sexual outcomes in general. So we do have to find a way to reach populations in a way that's trustworthy, that allows them to really benefit from the medical advances that so many other populations have benefited from.
So what are some of these advances?
Well, there's PrEP, which can prevent HIV before you engage in a risk behavior, risky sex, or IV drug use. So this is a medication that is highly underutilized in the African American community. And there's also PEP, post-exposure prophylaxis, which can prevent HIV after up to 72 hours after being at risk. There's also, there's vaccines now that can prevent some of the other STIs, like HPV. There's also simple knowledge, like now we're suffering from a lot of orally transmitted diseases.
Mm-hmm. So Dr. Kenya, I'm going to ask you to put a pin right there because we need to take a quick commercial break. If you don't mind, you are watching Black Health. We are going to take a brief commercial break. We will be right back. Please stay tuned.
I grew up down here in South Florida, so for me, it's a little bit more personal.
For the Mesman & Dover Law Firm, it's about community.
For us, South Florida's our home. You all are our people.
Our family, our future.
The difference we'll make for you, your loved ones, your kids, matters because to us, it's personal.
If you need us, call us 24/7 at 866-954-MORE.
That's 866-954-6673. The Mesman & Dover Law Firm, youraccidentattorneys.com.
When quality
At DRT Behavioral Services, we provide culturally sensitive mental health evaluations with thorough treatment plans, incorporating alternative forms of wellness, not just Western traditional medicine. Besides medication management and psychotherapy, we provide education to people in the areas of minority mental health with classes on your diet's impact on mood and sleep hygiene for better rest. We also offer weight loss therapy, massages, and facials. Visit brainlovehelp.com today.
Welcome back. You are watching Black Health, a platform to discuss health issues affecting the Black community. We are talking with sexologist Dr. Sonjia Kenya about sexual health in the Black community. I wanted to ask a question. Which STIs, sexually transmitted infections, specifically are we ranking the highest in as a Black community?
HIV and HIV-related death, chlamydia, gonorrhea, syphilis, and now we have drug-resistant gonorrhea and syphilis on the rise. And we also have the highest prevalence of HPV, human papillomavirus, which can be prevented in many cases, but we are, again, underutilizing the advances. HPV is the most common STD. I call it America's most popular STD is HPV. Almost anyone who's had sex has been exposed to HPV. Most times our bodies will clear it up. But if untreated, certain strains of HPV can cause cervical cancer. And now, due to the popularity of oral sex, we're seeing HPV is leading to more and more head and neck cancer. It's actually reaching, epidemic levels or endemic levels, which means, more than 20% of our head and neck cancers are resulting from oral HPV. So when we go to the dentist, we need to make sure our dentist checks our throat and has been trained to check our throat, because that's really the only way that you would find out. But the great news, Dr. Kirwan, is that we have an HPV vaccine and it prevents up to 90% of HPV-related cancers. So one thing I want to make sure all parents know is before your child becomes sexually active, seriously consider making sure that they get the HPV vaccine, because down the line, it may prevent them from developing cervical cancer or head and neck cancer, vaginal cancer, anal cancer. And when you're thinking about putting yourself at sexual risk, as you said, we don't really think about cancer, but we, unfortunately, Black people contract and die from more HPV-related cancers than other populations.
That's so unfortunate. Yeah, when people are sexually active, I think they're thinking, I hope I don't get pregnant, or I hope I don't get her pregnant. I hope I don't get a sexually transmitted disease. I don't think anybody is thinking, I hope I don't get cancer. But it can be a direct result of being sexually active. And one of the things I'd like to say about that vaccine is it can be given as young as the age of 9 years old. And a lot of parents in the clinic will push back when I start to offer it. I typically offer it around 11. And even at that age, there's a lot of pushback. My child's not doing anything. She doesn't need, or he doesn't need this vaccine. So I always explain to them, parents are probably the last people to know that their child is sexually active. So the idea is to get it in them and working prior to them becoming sexually active, which is why we give it so young. And they will either need 2 or 3 doses, depending on on when they're getting it. So I just want to, when they start getting it, just wanted to make that clear, because I know a lot of people are concerned about the age at which we start giving, that HPV.
I
vaccine.
agree with you 100%. And also, parents, remember, your child is much less resistant at 9 than they are when they're 15. So it's easier to get it before you're talking to them about condoms. Just make sure that part is protected. They don't even need to know necessarily what's going on. And the other part, for people who might be a little older, out of parental care, the HPV vaccine is now recommended for people up to age 45, which is a new change in the last couple of years. It used to only be up to age 26. So I've had, young people, medical students, or whose parents weren't on board for giving it to them when they were younger, who have taken it into their own hands to protect themselves.
Yeah. So let's switch gears and talk about HIV. There is a goal to end the HIV epidemic. Is Miami-Dade County truly the HIV epicenter, as we often hear?
Unfortunately, Miami-Dade is among one of the nation's top HIV epicenters. Liberty City actually is predicted to have the highest rates of HIV infections in the nation. A couple of weeks ago, Vice News came down and followed me around Liberty City to see what we're doing to address the HIV epidemic in our communities. And
let's take a look at that.
Try to educate people in a way that enlightens and increases understanding, but also empowers. Like, look at all these resources. Look what we can do about it. There is absolutely no reason why anybody should die of HIV or AIDS-related illnesses in 2023.
Wow. You mentioned, and to that point, there's no reason that anybody should die. You mentioned earlier, you started talking a little bit about being able to prevent HIV infection prior to having sex with somebody who's HIV positive, and even after having sex and being exposed to HIV through sex. Tell us a little bit more about that.
Absolutely. It's been so wonderful to be in the field to be in my field during this time when we've developed PrEP, pre-exposure prophylaxis. And this means that if you're adherent to PrEP, you can go and have unprotected sex and you will not contract HIV. And that's wonderful. So I like to remind everyone, if you think about someone in your family or your neighborhood or a friend who might be out there, as we say, who doesn't always protect themselves, who's more of a spontaneous person when it comes to their sexual behaviors, that's a perfect candidate for PrEP, highly underutilized in the Black community. We also have PEP, post-exposure prophylaxis, and which can prevent HIV up to 3 days after someone's been at risk. And so this is wonderful because, again, if someone has made a mistake the night before, or unfortunately, sexual violence is more common in Black communities. So if someone has been a victim of some sort of sexual violence, we now have the medication to prevent them from contracting HIV. So that's wonderful. And also, if someone is living with HIV and they're taking their medications, they can become virally suppressed. So the amount of HIV that's in their body is so low, we call it undetectable. And when someone is undetectable, they cannot transmit HIV to their partner, even when they have sex without a condom. So we really try to push these in our communities because unfortunately we have a problem of spreading HIV within our communities. And if everyone was aware of these medications and took the one that might be right for them, then HIV wouldn't be a death. Black people would not be dying from HIV related illnesses.
So if everybody that had HIV had an undetectable status, and we used PrEP and we used PEP, the pre and the post exposure, we really could end this HIV epidemic. Truly.
Absolutely. We have all of the tools we need to end this, which is why my job is so exciting, because we get I get to talk to Black people in a way. So if someone doesn't trust me, I've had some of our community members be like, oh, they got you on that. They got you believing that hype, huh? They got you believing that. And I get to see that person. It might take 4 times, 7 times, 10 times that we have a conversation. And then they start believing, they're like, okay, she's still coming around saying the same thing. Maybe, and being willing to engage with our community members, because, there's a lot of valid reasons why we distrust the healthcare system more than other populations. HIV care is free for people who don't have the resources to pay for it, regardless of someone's immigration status. Anybody who's HIV positive can have access to the Ryan White healthcare insurance program in the United States, which covers HIV care. So we don't need to be scared to take a test. But even that Ryan White information is not well disseminated in our communities. So it's very understandable why someone might be scared to take an HIV test if they don't think that they can pay for the medications. So we're here to make sure our communities know.
At my health center, we just have got a new grant to do HIV outreach. And we met with the Department of Health, the Miami-Dade Department of Health. And I didn't know this, but they actually send free testing, HIV testing kits into the homes. If you go to their testmiami.org website, they will send a free HIV test to your home, and also free condoms as well.
I was going to say as well, condoms, and male and female condoms.
Okay.
Right. And dental dams if you request them as well. So the Department of Health really does a great job at making sure care is accessible. I think from the healthcare provider standpoint, our organizations have to do a better job at making sure that our patients know the Department of Health is an accessible resource.
Yeah, and also know about PrEP and PEP. As I think education is the other piece that we need to make sure that we include in this picture. So what, if anything, is on the horizon for HIV in terms of a cure?
Oh, I'm so excited. I'm so excited about this, Dr. Kirwan, because we anticipate within the next decade, we're going to have a cure for HIV. And the first human trials are starting next year. So we're very, very excited. We also have a vaccine in the works. I talked with our chief of infectious diseases here at the University of Miami and some of the other scientists, and they believe that the cure will be here before the vaccine. Mm-hmm. And I think that the work that providers, especially, providers like you, people of color who may come across as more trustworthy to our providers, we really want to start engaging our communities in the conversation now. So when the cure and the vaccine is available, that we take it, because that's another challenge. Just like we're underutilizing PrEP and PEP, and condoms, we want to make sure that we also take advantage of the cure and the vaccine when it becomes available.
One community that we did not touch on is the LGBTQIA, I think it is, the Black LGBTQ community in the United States, because we have a large community. And how do we appropriately include them in eliminating sexual health disparities overall?
Great question. Right now, or in, I think it was 2019, which was the latest data I could find, over 1.2 million Black Americans identify as LGBTQ. And I think it's really important to accept sexual diversity in the Black community. Historically, a lot of our community hubs, like churches, have preached, it's straight way or no way, but that has really had a grave impact on our sexual health disparities. Several years, we had the down low phenomenon that was going on, whereas men were in heterosexual relationships, and they were also in non-heterosexual relationships. And what we learned as scientists is that was a big driver of the HIV virus among Black women. And so when we can accept sexual diversity in our communities, and we can allow people to be gay or bisexual or non-labeled or pansexual, then we can allow people to be safe. When I speak with communities, I say, if we don't know anyone in our churches, in our neighborhoods, in our families who are gay, You just have people who have not told you the truth about who they really are. And when people are unable to tell the truth about that, they engage in risky sexual behaviors because they can't be open and figure out in an open environment, how do I protect myself while engaging in my sexual relationships? So it's really, really important that we learn to accept sexual diversity within the Black community.
Absolutely. And with that, Dr. Kenya, we are coming to the end of our time. You have been a wealth of information. Thank you so much for joining us today. And thank you, everybody out there, for joining us today on Black Health. Our hope is you heard something today that can make a difference in your life or a loved one's life, and maybe even save a life. So join us next time again on Black Health.